Two physicians, one conversation, doctors on doctors.
Okay. Welcome to Doctors on Doctors. Two physicians, one conversation, and clarity in every episode. Today's episode is a little special. One guest, one journey, and a deeper conversation. I'm your moderator, Omar Al-Kayed, a recent medical graduate and a current medical intern. Joining us today is Dr. Amal Abu Libdeh, a professor and consultant in pediatric neurology and an executive board member of the Jordanian American Physicians Association. Thank you so much for being here with us today, Dr. Amal.
Thank you. Thank you so much for having me. Sorry.
Thank you. Not at all. Thank you. For our first segment today, we'll be focusing on your medical journey. First of all, we would like to ask you, why did you choose to pursue pediatrics as your specialty?
Sure. So first of all, let me thank you for having me. It's been great preparing for this episode, and I hope everyone enjoys it as much as I enjoyed it while preparing for it. So yeah, I know the question about the choice of specialty is a common question to be asked at this point. So I wish I could say that pediatrics for me was a lifelong passion or an obvious calling, but it honestly wasn't. It was more of choice by exclusion, so to speak. Choosing pediatrics for me was shaped by my cultural, my practical beliefs, and some personal factors. So, you know, as a female physician coming from a conservative religious family, my specialty choice was requiring balancing many things. So I had to think about cultural expectations. I had in mind my work hours, my lifestyle. I had to think about the availability of training opportunities in the specialty I chose, and also my personal interests and preference. I can say that one of the first specialties I easily excluded was surgery. It was actually my first clinical rotation, and I knew from day one that it wasn't for me. I'm not someone who necessarily likes working with my hands, and I just didn't like much the repetition of doing the same type of surgery over and over. So that was the one I excluded first. And then I kept going through the specialties one after the other until I came into internal medicine, which I genuinely loved, because I loved the complexity of the cases. I liked the way we approach the patients' cases and how we go through the diagnostic reasoning. And I also really liked the long and meaningful relationship with patients. Now, when I went into my pediatrics rotation in 5th year, it just felt like a natural extension of internal medicine, but it was even better because it had more of the things that personally interested me, because it basically had similar disease complexities and intellectual depth to what I saw in internal medicine. But I liked that it was even more diverse because it spans multiple age groups. You have to deal with many contexts, many patient populations. So I felt drawn to it more. Because in pediatrics, you're not treating just the patient, you're caring for their entire family. So you have that other aspect of care as well. And the other thing that drew me to pediatrics was the fact that children often have difficulty articulating their symptoms. Sometimes they are too young to tell us what's wrong and what's happening with them. So I liked that in order to be a good pediatrician, you'll have to learn to be an observant, creative, and intuitive physician. You have to distinguish when a child is truly sick, when they might need an urgent intervention, or they might just be fine. So that all shaped my decision into choosing pediatrics.
That's a wonderful answer. Thank you so much. So Dr. Amal, when you chose pediatrics after medical school, how did you imagine your future would look like?
So once I decided I'm going to be a pediatrician, the first thing that came to my mind is that if I choose this specialty, I'll have to be the best pediatrician I could be. I imagined myself from the very beginning becoming a specialist in a subspecialty of pediatrics and to be an expert in one of the major fields of pediatrics. So with that in mind, as I was preparing to start my specialty, I decided to put all my effort into my training, into gaining the knowledge, into learning the skills as much as I can. I just basically wanted to be the best I could be at what I do.
That's wonderful. Thank you. Okay, so Something very interesting about your career, Dr. Amal, is that you have completed 2 separate residencies in pediatrics. After completing your residency in Jordan, why did you decide to pursue another residency in the United States?
Sure. So I think the idea of training abroad was in my mind early on. I actually took the first step of my USMLE exams while I was in medical school. It was during my last year of medical school that I passed the first of the steps. I didn't necessarily go to the US then, but I kept thinking about it. And even after I finished all the exams, I still continued with residency in Jordan. That decision was based on my personal and my cultural beliefs. Again, being from a conservative family, the idea of me traveling alone was not acceptable. Also, for me personally, I really wanted to be married and have a family. And as someone who believes in traditional marriage, I felt that staying in my home country gave me a better chance of finding a partner and getting married. So for the first few years, I just decided to go on with my training in Jordan. I decided to put all my effort into that. So I did my best during my residency, both as knowledge, as skills, did really well during my test. I was the chief resident in my final year, did really well in the Jordanian board exam. And then after residency, I actually worked for 2 additional years in Jordan. One of them was at King Hussein Cancer Center as a hospitalist, and the other year at Jordan University Hospital as a teaching and research assistant. So that was the first, 4 years of residency and 2 years of working there. But like I said, thinking of training abroad was in my mind from the beginning. I just kept pushing that idea through. Once I got to that point, I realized more and more that really the first instinct and what was pushing me to think about training abroad continued to be a reality. I basically still wanted to be an outstanding expert in a pediatric subspecialty. And at least when I graduated, we didn't have a lot of opportunities to do subspecialty training in pediatrics. The other thing that kept bothering me is just that I noticed that during my work, physicians with Western training were often more appreciated and recognized compared to physicians who didn't get the chance to train abroad. I mean, that's disheartening, but it was actually the reality that I was noticing day after day. I mean, I met many outstanding physicians in Jordan who I felt that didn't receive the recognition they deserved simply because they have not trained abroad. So ultimately, I chose to leave because I wanted the recognition that reflected my level of skill and knowledge. I wanted to be the best at what I do and to gain experience in a pediatric subspecialty. And I did want to be an expert in a certain field in pediatrics, and I felt I needed to leave to achieve that.
That makes total sense. Thank you so much. So this brings on another question. How difficult and challenging would you say it was, both emotionally and professionally, to do another residency after already having become a specialist?
So I must admit, it was not easy. It wasn't easy. Emotionally, definitely not easy professionally. I think one thing that made it relatively easier is that by the time I went to the United States, I had gotten married to a physician who was already in the United States and who was very supportive of my career goals. So even as I faced difficulty during my training and especially repeating the residency again, at least I had that support, the emotional and the social support. Now, for me, as I was in Jordan and as I kept thinking about training abroad, I kept thinking of what else could I do instead of having to repeat residency. I even considered just going for a fellowship and coming back, or even doing an abbreviated fellowship, just 2 years instead of 3. But really, when I had my husband's support and after being able to stay in the United States for longer than I anticipated at the beginning, I figured I might as well do the residency because that is what will give me the full training experience. It will give me the full certification, the full accreditation, the American board. And I also wanted to have the full range of opportunities after I finish, whether I decide to stay in the United States or leave. I just wanted to have these options. And the American board would not have just helped me if I had stayed in the United States. As we all know, it's recognized everywhere, whether it was in the US, outside the US, whether it was in Jordan, the Arab countries, or elsewhere. So again, I wanted that recognition and I wanted that type of experience. So I decided to go for it.
Sounds great. Thank you. Okay, so I'm sure everyone will be wondering about this and asking this question. I'm sure there were many differences between your residency in Jordan and in the US. So, what would you say that these differences were, and to what extent would you say that they were transformative in terms of your experience?
Exactly. So, yeah, I mean, obviously, that was the main thing I had to deal with when I moved to the United States and did another residency. There were obviously many differences. Some of it is what people have dealt with whenever they go to the United States for further training. So I had to deal with a new culture, the language, and a completely new healthcare system. So first I had to work on my language skills, and I had to work on my accent. I had to adapt to different disease patterns and patients from diverse backgrounds. And obviously there was a completely different health system, including having to use electronic medical records for the first time of my life. Actually, the place where I was accepted, which was Shands Hospital at the University of Florida, they had started using the electronic medical records when I joined. So it was a learning curve for them, and it was a learning curve for me. Now, what helped me though was that I had the prior training from my pediatric residency in Jordan, and not only that, I had worked for 2 years as a general pediatrician. So what helped was that I had a solid foundation, and it allowed me to focus on learning what was new rather than struggling with the basics. So it helped me, and it allowed me to learn from what that system had to offer. And if I were to summarize the biggest difference as far as the healthcare and the training that I saw between the United States and Jordan, I would say it was probably the philosophy of care. Because in the US, I saw that there was a stronger emphasis on preventive care, things like well-child checks and family-centered care. They also focused a lot on things like communication, counseling, being clear when discussing prognosis and quality of life and lifestyle for patients. So that helped me a lot and taught me that aspect of caring for patients. So these differences didn't just make me a better physician, they also shaped me to care for my patients and for my own children. Because by then I had 2 children by the time I finished the pediatric training that second time, and it helped change how I view parenting.
That's lovely. So I have a follow-up question to that, actually. Would you say that one of the residencies had a greater impact on you than the other, mostly professionally, let's say?
I would say that I honestly feel I learned more in Jordan, because obviously that's where I learned pediatrics, right? Like that's the time where I was busy learning from textbooks. I had spent my time learning from all the resources and all that, and obviously learning all the skills. I think my residency in Jordan gave me more chances, more exposure to a bigger number of patients, definitely more chances to do a lot more procedures and be very proficient at them, and obviously dealing with higher critical patients. The way it works in the United States, and especially where I trained, is because they had a lot of fellowship programs. You'll notice that it lowers your chance of being exposed to certain numbers of diseases and to being able to practice procedures yourself. So there is a good thing about having a bigger system with fellowship programs, but there are also some drawbacks. So I would say that entering the residency program in the United States, obviously I was already equipped because I had already been board certified in my country. I did learn a lot from being there, but I would say that the biggest chunk of what I learned about pediatrics was in Jordan.
That's amazing. Okay, so after doing your second residency, you went into a child neurology fellowship, isn't that right? And then you also did another fellowship in pediatric movement disorders. So I'm curious about why you decided to go into neurology and what made you choose this path rather than many of the other subspecialties in the world of pediatrics.
Okay, so another interesting story of why I chose neurology, and maybe different from what people are used to hear. So when I entered pediatrics, I never imagined I would be a pediatric neurologist. It is a specialty that usually people shy away from because we always feel that it's intimidating, it's complicated, it's just generally sad. So what I did was that with my training in Jordan, we just happened to have 2 really busy, really outstanding pediatric neurologists. So compared to all specialties, we used to see so many cases of neurology patients. At the beginning, I was annoyed because I'm seeing all these patients and I have no idea what I'm doing. I'm basically following orders and getting the tests I'm being asked to do and all that. So my initial interest in learning about neurology was stemming from the fact that I just wanted to understand what I was doing. But interestingly enough, when I started learning about it, I started to really enjoy it. And I was like, maybe this is something I want to do. And, neurology remains a specialty that is complicated and with many cases that breaks the person's heart because of how difficult they are. And it's interesting that it was actually those types of patients that drew my attention and made me fall in love with neurology. So obviously, we always have happy cases and people that improve and get better. I actually pay more attention and put more energy into the cases that are harder, because in my mind, I feel that these are the patients that are requiring more attention and more support. So to continue with the story, when I was in Jordan, at some point, I figured maybe I want neurology. But then, like I said, I moved to the United States and was doing my residency again. So here I am with a program that had all the subspecialties in pediatrics. I had real exposure to every subspecialty in pediatrics from working with people that have chosen these specialties for their career. Initially, I was like, yeah, no, it's not neurology. It was just the familiarity that made me want to do it at the beginning. Maybe I'll choose something else. But to be honest with you, as I kept going from one specialty to the next, it's just neurology kept coming back to my mind. It was just the thing that fit just my personality. It checked every box of a specialty that I was looking for as far as my lifestyle, the type of patient, the type of practice. So I basically came a full circle and decided to choose neurology after all.
That's very interesting, Dr. Amal. So was there a moment when you would say neurology felt more of a necessity rather than an interesting specialty?
Definitely. So basically, going through pediatrics, I had wanted to be a specialist from the beginning. And then as I kept going, I know general pediatrics is an interesting field. I know many of my friends enjoy it and find it fulfilling, whether they do it as outpatient or more acute cases as a hospitalist. To me, I really wanted to be the best in a certain specialty where people would seek my opinion in difficult cases. So I had told you how I reached neurology, but by the time I got to that point, really general pediatrics was to me a step in a pathway that would lead me to specialties. And when I chose neurology, I didn't look back. That was the thing I wanted to pursue, and I never considered anything else.
Okay, that makes total sense. Okay, so a question with some reflection. Would you say that the longer path gave you something that the direct route never could?
So to me, it definitely did. Obviously, I cherish a lot the fact that I got the opportunity to train in two places and really, really experience what a residency training is like, both in Jordan and the United States, with them being very different. So did it help me? Obviously, it helped me with my career options. It helped widen my perspective, and it helped define my roles in every aspect. Let me just stop here for a second, Omar. I'm losing my train of thought. Yeah, okay.
انا في اشياء مثلا اسئله عم بفشقها وعم بجمعهم مع بعض.
بس انا هلا مش عارفه شو اللي كنت بحكي، استنى شوي. Okay. All right. Yeah. Okay. Yeah. I think I'm back. So I'm good with what I said, and I can continue. Would that work?
ممتاز طبعا تفضلي.
Okay. So let me see what استنى مش عارفه ليش انا هيك خربطت، استنى شوي.
دي بسيطه ولا يهمك، لو بتحبي نروح على السؤال بعده بنقدر كمان.
No, I mean I can finish this one because, like I said, I felt like the questions were related. Okay, so let me answer this the way I intended to answer it. So what I wanted to say is that when I was at the University of Virginia, that's where I did my neurology training, and that's where I worked for 5 years before moving back to Jordan. When I was at the University of Virginia, I was heavily involved in teaching medical students, residents, and fellows. Right now, I'm the program director of Pediatric Residency program at the University of Jordan, and I remain heavily involved in teaching medical students as well as pediatric residents and pediatric neurology fellows. So because of my diverse training background, I'm able to advise and mentor my trainees a lot more effectively. I understand different systems, I understand different expectations and the differences between the two different training cultures. And just to clarify, I do not recommend the longer path. I don't recommend doing long residencies. For me personally, I think it was worth it. I think I benefited greatly from it. I think I'm a better physician because of the experiences I went through. But obviously, if someone is not having to do the longer training I had to do, it will probably be better and it will help them achieve their goals.
That's a very inspiring answer. Okay, so while doing all of this, did you ever feel that you were maybe losing time or falling behind peers? Did these thoughts ever cross your mind?
Yeah, I think at times, yes. And I mean, I'm going to be honest and say that there were many times where I felt frustrated when I was comparing myself to people back home, my friends who had already started working, people at my training programs in the US who were younger than me. I think it used to hit me hard whenever my senior would be someone who's a lot younger than me. So I would have to think about it for a second. But to be honest, I always focused on my goal and why I'm doing what I'm doing. The nice thing that happened with me when I was at the University of Florida was that I had other people who were of similar age to me just because they chose to do different things along the path. So they had, spent a few years here and there. But the thing that thing helped me, especially that they had also diverse backgrounds. So that helped me fit in with them. When I was at the University of Virginia, I would think that it was harder because the trainees there were more homogeneous and they were younger. So again, that always came to my mind. I always remember one time I was doing my neurology fellowship and the intern in the program was 10 years younger than me. So I think that was one of the lowest points to me and something that where I had to stop there and feel like I'm doing this for a reason. I have a certain goal and I have to keep pushing. So during the years, there were times where I would just take a second and be like, what am I doing? And this is taking too long and I'm getting too old. To be honest, once I finished and achieved all my goals and was hired as an attending, that all went behind my back. It's something that I always tell people that are worried if they are at a point that I passed through, where it's like, what, when you're done, nobody asks how old you are. Nobody asks how long it took you to get there or how many years you spent training. So even though you might personally feel that way, if it's taking you longer to get to your point, just know that it's probably just you and other people are just interested in the type of physician you've become and the type of experience you've gathered rather than looking at the numbers and the years.
Yeah, so at the end of the day, it's mostly or all about the result.
Yeah, exactly.
Yeah. Okay, so now for the last question from this segment, coming from someone who had a very unusual, untraditional career, who's had many switches, many changes, how can current medical students, interns, and residents know when to pivot or when to persist?
Yeah, so I always feel that it's better if you know your goal from the beginning. That would be the most efficient and the least energy consuming and the type of path that will help you achieve your goals sooner. That being said, not everybody is that fortunate. And I always say I'm someone who tends to decide on things later, which is okay. I always feel that it's probably because I always have so many things to consider. So it takes me longer to make a decision. And that's perfectly fine as long as I acknowledge it and I embrace it. So I feel like if you know what you're wanting to do, then good for you. It's amazing. I encourage everyone to do that. That being said, it may take you longer to decide, and you may decide on something right now that later on may not feel the right path to you, or you may not be as successful as you wanted it to be. And I think it's perfectly fine to pivot. One thing I like about medicine is that at every stage in your career, there are so many options. So when is the time to pivot? Really, you can pivot at any time. The sooner you decide and stay focused is better. You don't have to be miserable. If at any point in your career you feel that's not the path for you, you should be able to make shifts to find what's more appropriate.
It's very insightful. Thank you. So, thank you for sharing with us all these personal stories from your very inspiring journey. Now, we will be moving on to the next segment, and we will be talking about real clinical experiences. So, could you maybe please share with us a certain case that either impacted you deeply on a personal level, or maybe one that was very unique on a professional level, where it reaffirmed your choice of your specialty?
Sounds good. So yeah, there are so many of these, and these are the types of cases that I enjoy presenting whenever I'm invited to talk at a conference. I'm someone who prefers not to give actual lectures when I'm invited to conferences, but rather to share stories where people can remember the details of the story that links them to the clinical knowledge and the take-home messages. So many examples, but I think my favorite and the one I thought was most appropriate for this podcast was about a boy that I actually met at Jordan University Hospital not too long ago, maybe several months ago. His case touched me in so many ways because of the social circumstances. And like you said in your question, it affirmed the importance of what I've done and the type of knowledge and experience I've gained. So this boy is 11 years old. He's previously healthy. Had this interesting story where one day he just developed chickenpox. And you know, chickenpox has a vaccine, the varicella vaccine, which unfortunately is not yet part of the national program in Jordan. So we are still seeing cases at a relatively older age that unfortunately get this infection. And for the most part, many people think it's chickenpox, it's just the rash, and then you're fine. Unfortunately, in neurology, we're not in agreement with that because a lot of times we do see some post-infectious complications with this disease. But what happened with this child was quite different and quite not what we would expect even from someone who was affected with chickenpox. This child had the rash, and then it disappeared within a few days, just like it's expected to be. The rash goes away. The next day, he's unable to walk. Just like that. He's paralyzed from the waist down, couldn't bear weight on his feet. So we are used in medicine, especially in neurology, to Guillain-Barré, right? Like you have someone with an infection, comes to you unable to walk, easy, you see. So that's how he presented to an outside hospital. And that basically was their first suspicion, knowing that it comes after a viral infection commonly. They tested him with Guillain-Barré. You would expect to have what we call an ascending symmetrical paralysis. So he had that. He had absent deep tendon reflexes, which is what we would expect with Guillain-Barré. They did what is expected as part of the workup to confirm the diagnosis. So they did a CSF analysis. So they took a sample from the cerebrospinal fluid and sent it to be analyzed. Normally or characteristically, in cases of Guillain-Barré, you would expect certain findings where you would have high protein, but normal white blood cells, because it's an inflammatory process rather than an infection. He didn't have that. His CSF analysis looked fine. Now, early cases of Guillain-Barré, sometimes that can happen. So that was that. They also did imaging. So what do you expect with Guillain-Barré? It's a disease that affects the peripheral nerves, the anterior horn cells. So you would expect inflammation and enhancement of these nerve roots. They said he didn't have that, which again, you could maybe, again, it could be in the early cases. So they basically empirically treated him as Guillain-Barré with what we normally do with IV immunoglobulin. Normally, you would expect the child to improve with or without your treatment. The purpose of the IVIG is basically to expedite the course and help them recover better or faster. What was interesting about this child was he actually didn't improve at all. He continued to have the dense paralysis of both lower limbs with no sign of improvement, even after spending the whole entire month waiting for that improvement to happen, which is highly unusual for his case. What was also concerning was that in addition to the weakness, he had no sensory issues, which is, typical for Guillain-Barré. He had some paresthesia at the beginning, but that then resolved. But what was concerning was that he had urinary retention, where he had to get a Foley's catheter, and he had significant constipation. Could you have that with Guillain-Barré? Sometimes you get some autonomic instability and disturbances that might cause bowel and bladder issues, but not to that point. So we come to neurology. What do we do in neurology? We localize in neurology, meaning you tell me your symptom, I tell you where it belongs in the central or peripheral nervous system. So up to the point we were talking about the peripheral nervous system because you're dealing with paralysis, decreased tone, and absent reflexes. Well, what about the urinary retention and constipation? That's a bit higher. You're talking about the spinal cord to have such significant symptoms. We don't see spinal cord abnormalities in Guillain-Barré. So there was a problem there. And then there was another thing. If this child, when he presented initially, had all these symptoms, do we truly think that his imaging was normal? And can we get that previous imaging to see what it shows? We ended up transferring him to our hospital. We needed to review his case. Our initial thought was, hey, look, you tried one immunomodulatory treatment. Let's try something else. Maybe we'll have a better luck. Typically, patients that don't respond to the first course of treatment, they don't do very well with another form, but what's the loss? We can do that. What was interesting about the social aspect of this child was that he was coming from a very humble family. He was the oldest. His father was a butcher. He was at work all day, working even weekends. His mother was a very humble, simple woman who was just by her son's side for a volunteer month in the hospital. Now, this child, when he came to us, he was very upset, I would say even rude to everybody, because by then he had stayed for a month in the hospital, not being able to move and in a diaper. So he was not happy. He was yelling, screaming, calling people names, refusing things. You put the IV line, he'll pull it out, and all that. But in addition to that, he was really intelligent and he would understand what you were telling him to do. So we had an open discussion with him about the expectations. You're having this serious problem. You're unable to walk. You already tried one form of treatment. We need to confirm your diagnosis, see if we have a different diagnosis, and we need to try something else for you. But we can't force you. You need to be aware of what you're doing because we can't force these treatments on you. What we initially did was we repeated the imaging, and sure enough, it showed what we expected from his clinical picture. He actually had an involvement in his spinal cord. It was strange, so we got to the initial imaging. That one was actually misread, and even the initial imaging had shown spinal cord involvement and nerve root involvement. So the diagnosis was different. It was now what we call acute flaccid myelitis. It changed the course of treatment, but also changed expectations. Unfortunately, acute flaccid myelitis patients, a lot of times, they don't respond to any type of immunomodulatory treatment you give. So we were glad that we reached the appropriate diagnosis, but sad that the usual prognosis for these cases isn't that great. Usually these cases follow certain types of viruses, but not necessarily varicella. Only a few cases were reported after varicella. We had nothing to lose, so we decided to proceed with the treatment and do plasma exchange. They were extremely worried about it because it's such a subspecialized critical procedure that is not performed everywhere. You will need a critical care unit that knows how to deal with them. You need a team that knows how to perform this procedure. Luckily, it went well, but I must admit we didn't have high hopes for it, but we didn't have the alternatives. So the way the plasma exchange works is that you do 5 cycles every other day. It's similar to what you would do with dialysis for someone with renal impairment. The boy couldn't move his legs at all. We do the first cycle and he's moving. By the second cycle, he is moving even more. By the third and fourth and fifth cycle, he was getting up, walking with a walker, got rid of the Foley's catheter and the diaper, and significantly improved just by the time we were leaving. So this was an amazing way of applying the clinical reasoning and the concept of localization in neurology, of questioning every simple piece of information that you're given for a patient, not taking anything for granted, not accepting things that don't make clinical sense, and take chances with the patient, even if a procedure was risky. The icing on the cake was how his attitude changed. He's now one of our favorite patients. He loves to come visit us in the hospital. I remember as he was finishing his treatment, we had the exams for the residents, and we usually want a volunteer, one of the patients, and we need someone who has findings, so it's not like the students. He volunteered and allowed all the residents of that day to examine. you participated on the exam. So it was a very happy ending to an otherwise sad story and a reminder of validation for everything we've learned and we do.
That's such a wonderful and a very interesting case as well. Thank you so much for sharing it with us, Dr. Amal.
Sure.
Okay. So now moving on to our next segment. Dr. Amal, you're a member of the executive board of the Jordanian American Physicians Association, known as JAPA. Now, of course, JAPA is a very popular establishment and organization with medical students in Jordan, especially those who are eyeing a residency or any kind of training program in the United States. So, for this next segment, we would like to highlight your role within this organization. First of all, I would like to ask you to please tell us more about JAPA and also about your role and position within this association.
Sounds good. So moving on to JAPA, the way it started was a social group. I was one of the first people to join the Facebook page that Dr. Bahat Tanwimi created in 2014. Initially, the goal from it was to socialize, to establish connections between Jordanian physicians that had trained in the US. We would answer each other's questions, help each other with our career, day-to-day stuff, and so on. As time went by, we started using this Facebook group to become more organized and to help people more. I recall in the first few years, back in 2014, I had basically started my neurology training. Within a few years, I had finished. I recall I started helping students with their applications as they were applying for the match. I'm someone who needed a lot of support and guidance when I was going through my journey of, like the ERAS and the match process and all that. So I was trying to give back by helping students during their applications. So I would review their personal statements. I would give them my opinion during, regarding their application and so on. What also helped me was that both when I was at the University of Florida and at the University of Virginia, I was actively involved in the recruitment committee. So I would review hundreds of applications along with my American colleagues. I would get their immediate feedback. What do they think? What do they see in these personal statements? What do they look for in the application and so on? So with that, I was helping more and more students. As I became an attending in 2017, I started accepting students for elective rotations in my hospital. So again, more and more involvement in the match process. I recall in 2019, I posted on the Facebook page group saying, hey, I'm literally reviewed hundreds of these personal statements. I want to tell you the things that keep coming up all the time, and I have saying them over and over. So I remember I posted these points for students and applicants to pay attention to. And after that, followed certain posts where we were encouraging applicants to tell us if they want us to help them review certain aspects of their applications. Mm-hmm. I'm proud to say that this evolved as we evolved within JAPA into another initiative, a major initiative. So going back to JAPA, it started with a Facebook group in 2014. In 2020, it became an official group, official organization that is registered in the US as a non-for-profit organization. And we recently also registered it here in Jordan. Within JAPA, we've had so many initiatives that target many domains, mainly the advocacy, the humanitarian efforts, as well as the education. As far as the match process, what started as random invitations to help students by reviewing their personal statements and applications turned into a major initiative through JAPA that we coined into the term MMP, Match Mentorship Program. We started it in 2021. This year is the 5th year. We've had hundreds of Jordanian graduates through their match process by helping them and supporting them on every step of the match. So what we do is at the beginning of the match season, we ask Jordanian American physicians to volunteer to be mentors, and then we encourage all the Jordanian applicants to join our groups. We divide them into groups where each mentor will help few students through the different aspects of their application. And throughout the match season, we are providing webinars with time for discussions and asking questions to cover all the aspects. At the end of the season, the applicant would have time to ask questions about their application, practice mock interviews, get advice about their rank list, and what happens even after the match day. And we even help them with the visa and how to do it and what to get when you want to, get to the United States and so on. So we have 5 years worth of applicants that we have helped along the way. We have 5 years worth of statistics that apply to the Jordanian applicants that help future applicants with our efforts. The other efforts that have to do with education include the elective program, the research program, the loan program. So many initiatives that has to do with education in addition to the other aspects that JAPA work on.
That's truly admirable work. I'm sure many students and now maybe some even residents who are now in the US truly appreciate all you have done at JAPA. Dr. Amal, as someone who's very passionate about the community, helping the community, building the community, and also as someone who has been working so actively with medical students in Jordan to help them get a chance at doing their residency in the US, would you say that there were certain major gaps or issues with Jordanian or IMG trainees in general that pushed you into JAPA leadership and made you want to take on this role of guidance?
Yeah, I mean, I think a lot of it stems from our difficulties. I think that the best way to look at the challenges you face is to think of what type of support you needed, what type of challenges you faced, and then to turn it into opportunities to help people facing the same challenges. So like I said, I'm someone who relied on other people's guidance and support in every stage of my career. And as I finish every stage, I would turn back and say, okay, like, who else can I help to achieve the things I achieved with the help from others? So I think one of the main things that drew me into JAPA was the fact that we are organizing the efforts of the people who are interested in helping others. So, doing these things, I was putting these posts, and I was using my personal page to try and reach students to help them the best I can. But then I was honored when I was approached by JAPA's leadership to join their executive board and their founding board, because I felt that it allowed me to do it in a more organized way and at a much bigger scale. So it aligns with my goals, it aligns with my passions. There are so many diverse initiatives that fit the preferences of so many people. That's why you find so many of us involved with JAPA, and each of us focuses on a few projects that align with their preferences and their mission.
Mm-hmm. And that's honestly amazing. Thank you for that. Okay, so as someone who holds multiple leadership roles in academic posts as well, in the university as an associate professor and in other positions as well, how would you say that JAPA leadership differs from academic leadership?
Right. So one thing about academic, I think whatever I'm providing for my students at the University of Jordan, JAPA helps me expand the same type of support and help to medical students from all medical schools. And this is just an opportunity that's been a lot more fulfilling for me. Now, the other thing is that it provides other ways of helping students in addition to the traditional teaching, evaluations, exams, and all that. So it allows us the opportunities to mentor them, to improve their research profile, to help them prepare for their journey after graduation. We also have the volunteer aspect, which also helps medical students improve their volunteer profile. And then obviously the humanitarian aspect, even though it's not necessarily directly related to academic, it helps me achieve that aspect through an organized way.
Understood. That's amazing. Okay, so do you have anything else that you would like to mention about JAPA before we move on to our last segment? Anything you would like to share with anyone who's listening?
استنى شوي. اوكي. هلا بتشيلوا لي استنى شوي عشان انا Okay. Yeah, so the thing I wanted to share about JAPA, خمس من said many students and residents would look back at what JAPA has helped them with and would want to help. And to me, that's exactly what we're looking for in JAPA. We all started at the same place that many of our students and residents have started. What warms our heart is when someone that we've helped moves to the next stage in their career, make a successful career in the US or elsewhere, and then comes back to us and asks how they can help. This is how we can ensure that JAPA's mission will continue and that the next generations will carry the mission. So there is nothing that warmed my heart more than having someone reach out to us because we helped them or he heard about us offering to help. I hope this spirit continues and that we have more people helping us because we do have a lot more initiatives coming on.
Wonderful. Thank you. I hope so as well. Okay, now for our last segment with you, Dr. Amal, we will mostly focus on questions related to current medical students and interns who are pursuing a residency in the United States, perhaps those who are actively planning on it or even those who are thinking about it and considering it. So my first question is as someone who's had so much experience reviewing personal statements by IMGs. What are the first indicators that you would immediately see in any personal statement that would tell you that this applicant is weak or that his application, generally speaking, is weak?
Okay, so when it comes to personal statements, we always say, don't put too much weight into it, but also don't ignore it. The thing with it, though, is it rarely would make or break your application. But as you're trying to get into matching in the US, you might as well work on every aspect of your application and try to make it perfect. So personal statement wouldn't necessarily be the one factor that lets the program decide if they should invite you or not, or put you on the rank list or not. But hey, it's one thing you should work on and you might as well do it right. So to answer your question, there are certain red flags, like big issues with personal statement that you really don't want to see. So now, especially with AI, it was less prevalent before, but now with AI, really nobody wants to see a personal statement with major grammatical and language mistakes. I mean, we're way beyond that point to where if you're seeing that, your point is like, you're not even trying if you're giving a statement this way. Now, there are things that shouldn't be said in the personal statement, as in they shouldn't be said anyway. So rarely you would find someone who would put something that doesn't support inclusion or something that should be misinterpreted within a certain political environment or climate. These things should be avoided. Now, on the other hand, a lot of the personal statements would be what we call cookie cutter. So they would be very similar to where, at least within Jordanian applicants, for some reason, people have this notion that there are certain things you need to mention in the personal statement. And sometimes students will stick to them so much that all their personal statement will sound the same. So they all start by saying us, oh, why do you want to go into medicine? Why did you choose pediatrics or internal medicine? Why do you want to come to the US? So I always, when I'm reading these personal statements, I ask the students, do you think anybody can take this personal statement and use it as his? If they can, then it's not specific enough. It's a personal statement. I can make up one now. Internal medicine is about depth of knowledge, and I love the United States because of its academics. If that's your personal statement, then it didn't tell me anything about you. The purpose of the personal statement is to tell me something about you that I'm not getting from your application, because you're already telling me about your research activities and what you did for volunteering and where you graduated medical school. Do not re-mention that because it's already there. And by the same token, do not make it cliche and very repetitive, similar to what would be predictable otherwise. Tell me about something that will help me remember you. I read your personal statement to find something unique about you, to tell me that you're someone who's balanced and does things other than medicine. And then if I'm reading it right before I'm interviewing you, I'm looking for something to talk to you about. So give me something. Talk about your family. Tell me something about your hobbies. Don't list 5 hobbies and tell me about your hobbies because I told you so. Tell me if you're doing something different, and that will help me remember.
That's very useful. Okay, so a piece of advice from you. If there is one thing, one major thing that an applicant can change right now about either their personal statement in specific or their general application, what would it be and why does this thing matter the most?
I think changing the mindset and understanding why we're looking at the personal statement is what helps most. If you understand when am I, as someone who's reviewing your application, when am I looking at your personal statement and why do I need it? If you think about it this way, it will help you reframe it better so that it will stand out. I always say, if your personal statement doesn't help you with your application, at least make sure it doesn't harm your application. I'm fine with a cookie cutter personal statement, probably not going to help you much, but don't put something there that will hurt you. So I know that there is something that you will change now. If there is anything we need to do back to your initial introduction about this topic of, like if someone is planning to apply in the United States and all that, I would think this is not something you'll wait until now to change when it's time to apply. It's actually something you start working on early on. Before we started recording, I asked you guys each where you are with your journey and what you're planning to do. I'm always impressed by the medical students who start working on their career goals early on. We want medical students all to do that. So no, when it's time to apply, it is what it is. There is hardly much time to publish something or have a meaningful volunteer experience or add much to your personal statement. The way to do that starts sooner, and this is what we are in JAPA focusing on now.
Okay, that makes sense. So a follow-up to that question, let's say a certain medical student in their early years, perhaps in their third or fourth year, is thinking about the United States. Of course, they know about the traditional things they have to do. For example, that they have to do the steps for the registration. But what is something that you feel is sometimes maybe underappreciated or undervalued that is actually very important in the application and that maybe these students can start working on during these years of medical school?
Yeah, I think one thing to think about is the language and the getting used to talking and all that. I think so many students are outstanding with their grades and everything they work on, but they may not be as easygoing when someone is talking to them. So again, getting in the mindset of, hey, like this is your chance. I need you to make a good impression when we first start. I know this sounds like it's logical and it makes sense, but really so many people that have succeeded otherwise academically would fail to work on their communication skills and their interview skills and their language skills and even answering the most common and expected questions to where it will really hurt their chances in matching. The other thing is volunteer. So we know every applicant is expected to show us something about their volunteer experiences. One thing that applicants tend to do is they think of volunteering as, hey, like it's a box I need to check. So I went to this free medical day. I'll just add it to my application and move on. Really, when we're looking at a volunteer experience, we are looking for something more meaningful, something hopefully more long-lasting that went through different stages and that made a meaningful product. So there are many opportunities, whether it's through JAPA or any other organization, and luckily everything is connected even between universities. So I would think that people, in addition to focusing on academic excellence and obviously research, they should focus on building a good volunteer portfolio, because that will help give us a different aspect about the person and will help shape your career later on if within your volunteer experiences you find something that might interest you in the future.
That's very insightful. Thank you, doctor. Okay, if you have something in your mind, do you have any real-life example of an application that maybe seemed like it was going to fail in the beginning, but then it was deemed to be redeemable, let's say, despite its flaws, and the applicant actually got in?
I think there were some students that I met along the way. I'm usually a good judge of character, and I'm good at selecting whether someone will make it or not. But I must say there were many students along the way that I met the first time, didn't really think much of where they're going to go, didn't think they would be successful just because of where they started. And like you said, they ended up surprising me, and they ended up having very successful careers and matching in great places. I think they are the ones who listened to feedback, listened to advice, and applied that feedback effectively. The ones that acknowledged their flaws and their limitations and worked on them. So I may have seen people with poor English language skills or poor communication skills or not really working well with their application and how they worded their personal statement and so on. From a first impression, you would feel that these may not be great applicants because you will see people otherwise who are perfect in every aspect. but it's their perseverance and their hard work and just being willing to put the effort into it. There are people where you could give them feedback and they would take it personal and take offense in it and basically try to contradict what the person is telling them. And obviously, you're doing this to help people, and obviously, we're not good trying to make little of anybody. It's the ones who appreciate the type of support that they're getting and apply it to improve their performance and really are looking to work hard on improving things. They are the ones that have surprised me and achieved things when I first met them I did not think they would be able to achieve.
That's lovely, honestly. Okay, so Dr. Amal, from your experience as a former resident in the United States, and from your most recent experience as a member of JAPA, what general advice would you give to medical students today who are seeking residency as IMGs in the United States?
Right. So going back to the same idea of it's trying to be prepared early on. You have me as an example of someone who's done it really late. So there is always that, but we were being that you as a medical students. Hearing this podcast as medical students means that you've already achieved things that we did not achieve when we were in university. So you have no excuse. You should start preparing your. It's nice that you guys have this amount of guidance and you're already aware of everything you have to do, what you should manage your. My advice is not to panic, not to feel that, oh my God, it's already too late, like I hear first and second year students say. No, it's nice to know, it's nice to learn. You're in the process of gathering information. Consider all options. Do not commit to one option yet unless you're very sure. But gather more information and talk to people and see what everyone is doing. Once you decide what is most appropriate for you, start working on it and look beyond what you're learning in medical school. It's important. You should do well in medical school, but don't restrict yourself there and look for opportunities and work on your career option even early on in your medical school.
I get that. Okay, so a follow-up to this question. How would you say that applying to a residency in the US is different today than maybe when you applied?
Oh, very different. I think what is different is the availability of information, to be honest. Like every time I see someone going through this journey, we just wish we had that. It's just the simple answer. You're looking at the details, it's always been the same. Like the parts of the application have been the same and the things that people look for have been the same. There are minor changes in what you put in your application, how many experiences can you list, what does a high mark in USMLE look like, but the requirements are generally the same. What's more different now is with the availability of mentorship, with the availability of information in general, starting from when you're applying for the USMLE and all these free resources that we never had, to every step of the way, to JAPA's Match Mentorship Program, which I had when we were applying, means that we have more opportunities to, mentor applicants sooner. Now, what it also means is that the applicants are becoming more and more competitive. So, every year you hear the same sentence that the match is getting harder. Well, it's not getting, but they always more or less match the same number of IMGs. We had those statistics when we did the match symposium where we looked at the number and percentage of IMGs that match every year, and it actually increases every year. So it's more or less stable or more. What is happening is that more people are applying and better when people are applying. So I always say that IMGs are competing amongst themselves, even though the requirements as categories have remained the same. The quality of applicants have become better, which means that for you to stand the chance, you have to do better because you're competing with people that have put more effort, that have done more research, that have done more clinical rotations, and so on. To give you an example, many of us will tell you that at our time, I personally did not do US clinical experience. I think I had one case report when I applied. Granted, that was a long time ago, so there's that. But truly, what is happening now is, if you ask me, can you match without doing a US clinical experience or without having some research experience? Well, it's not that you can't, you can, but the chance is less. And the probability that if everyone around you is going for a US elective and is benefiting from connections and letters of recommendations and knowledge, and if everybody else have some research papers, the people that are checking your applications have no way of doing that except to feel that they are better qualified than the person who doesn't have these types of experiences.
Definitely.
So more mentorship is available, but I think the expectations are higher because the applicants are becoming more competitive.
So do you believe it's accurate to say that the match is now easier or harder than before, or do you say it's more of the same?
I think it's harder. I think the applicants that are applying now definitely have better qualifications than we did. It was harder for us because we didn't have a lot of information and we needed to figure it out on our own. But I think the expectations are more now, higher grades, more research. US experience is becoming more or less of a must to increase the chances. So it's becoming harder in that sense. The other thing is that we have more medical graduates. So you're competing with many other people. That also it's becoming more of a necessity. So in the past, there was nothing wrong with staying in Jordan and doing your residency there. At least you have spots. Right now, the number of residency spots available in Jordan is only a fraction of the number of medical graduates. So don't wait until you graduate to feel surprised that the spots are limited. They are really limited. So you should start planning soon.
Okay, I'm sure you've had this question asked to you before. I hope I'm not boring you with all these questions, but I'm sure that the students will find them very, very insightful and useful. So if a student who's listening feels that he or she is behind, or maybe unsure about their direction, unsure about what they want to do after medical school, what piece of advice do you think would be useful to them?
Gather more information. There are so many students that will come to us at various stages saying that they are confused, they don't know what they're doing, they don't know how to decide. Well, it's better sooner rather than later. So I'm fine in the fifth or sixth year asking that question, preferably if you can decide sooner, then sure. But it usually takes you time to experience various rotations and make up your mind on the type of specialty and where you want to do it. Now, what breaks my heart is when someone who's like me, like finishing their imtiaz or their intern year, and they still have no idea what they're choosing, and they basically choose last minute just because that's what they got or that's what they managed to go into. Mm-hmm. You have time to gather that information. You are surrounded by physicians all the time. I'm not there just to give you a lecture. I'm not there to force you to take history from patient and present it to me. You can ask me about my career choices. You can ask me about the options I chose along the way. And that applies for every other attending you see. What I liked about being in the United States is that you have students starting from when they're in high school, starting to explore career options. I've had people coming from school to shadow with me. Obviously, undergrad students will come to us all the time. And obviously, there are medical students who come to us trying to explore different specialties. And I've had so many of these students, many of them chose medicine, many of them even chose the specialty that we're going into, because many of them would come to neurology because they are thinking of neurology and wanted to validate their preferences or their desires. What I also liked is the people that came to us and then decided, you know what, that's not for me. That's good too. And the sooner you see that, the better. There were people that would come ask me questions, and you can tell they're not interested. They don't like it. It's just not, it's not meant for them. And we keep going, and then you get a message a month or 2 months or 6 months later saying, thank you, I just decided I don't like that, which is perfectly fine, but at least they decided and they made the right choice. So if I can make a piece of advice for these students that we're talking about is, you are surrounded with people that can help you. Just ask questions. Go to their office. Ask them to find the time to meet and ask all the questions in your mind. How much money do we make? What are the differences between the different settings of practice? What does it mean to go into private versus academic? Why choose to be employed by a hospital versus opening your own clinic? What do I like about my specialty? What I like about my specialty may make you decide it's not for you, which is important. But know what makes it more important for me, so you can decide what's more important for you.
That's lovely, honestly. Thank you so much. Wonderful answer. I have one final question, which is, would you do it all over again?
Yeah. Would I do it all over again?
Yeah.
What do you mean?
I mean, everything you've done, you've had quite an interesting career, lots of fluctuations. You've done 2 residencies. You've made lots of choices, obviously. Your residency, your specialty, your fellowship, where you're working now, where you're living now. You could have done it any other way, you know? So would you have done it the same way if you could go back in time? Or do you have any regrets?
This is a personal answer that doesn't necessarily apply for everyone. I now do not regret any of my decisions. There was a time where, like many medical students, while I was in medical school, I had major doubts about why I entered medical school and whether I should continue. That is a time in the past. I love being a doctor. If I had to do it again, what I would change is I would go into medical school with full energy and liking it, because I think the time that I spent hesitating consumed part of my energy that I could have otherwise used to enjoy my time in medical school. So I do not regret that. Now, do I regret choosing pediatrics? Definitely not. Do I regret choosing pediatric neurology? I could not imagine myself being anything other than a pediatric neurologist. Now, do I regret waiting and not going to the United States because I was not married? I do not. It was a personal choice I made at the time. It delayed my reaching my full potential and graduating to be a consultant, but I would not have done it any other way. So thank God. At this point, I can say I have no regrets, including that I don't regret coming back to Jordan, and I think it's the best thing that happened to me.
That's truly inspirational. Thank you so much. Dr. Amal, it's been a real honor and pleasure to have you on our podcast today. Thank you so much for everything. We're very, very, very grateful for your stories and for your advice and insight. And we wish you the very best of luck. This was Doctors on Doctors, real conversation between physicians for those still finding the way. And we'll catch you at the next episode. Thank you.
Amal, I wanted to say something at the end. Thank you so much for all your insightful questions. You guys spent so much time preparing for this episode. I've never had a meeting where people have worked so hard to prepare for it. You guys are working in a professional, organized way. I enjoyed talking to you. I loved answering your questions. The flow was amazing and smooth. I wish you guys the best of luck to you and everyone who's listening.
Thank you so much. This means a lot, and the pleasure was all mine. Thank you. يعطيك العافية.
إن شاء الله.
دكتورة. يعني انت جد كل الاميزنج honestly، يعني شرف كبير لنا.